Hello and welcome to Theoretical Perspectives, Bipolar Disorder and Appropriate Interventions by Kevin Clark
and Tafazo Bless Joala.
Throughout the course of this presentation, it will become clear what mental health is and how it's defined, what theoretical perspectives are and how they are applied in the process of diagnosing and treating mental health issues, and what bipolar disorder is by definition, by diagnosis and by treatment. The World Mental Health Organization defined mental health as a state of mental well-being that enables people to cope with the stresses of life, realise their abilities, learn and work well and contribute to their community. They elaborate by saying, mental health is more than an absence of mental disorders, it exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress and potentially very different social and clinical outcomes. Whereas the Substance Abuse and Mental Health Services Administration say that mental health includes our emotional, psychological and social well-being. It affects how we feel, think and act and helps determine how we handle stress, relate to others and make choices. They say that many factors contribute to mental health, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and family history of mental health problems. So, how can there be multiple definitions of one subject? This is because of theoretical perspectives, or simply looking at a subject through a certain perspective gained by a pre-existing theory. Theoretical perspectives, or models as they're commonly known, are an aid to thinking about and researching scientific problems. In regard to mental health, these are split into formal scientific models that derive from theories that bear a systematic relationship to the problem, like the biomedical model, and informal models that more accurately analyse a specific paradigm rather than the broader theory. It's these informal models that are more typically used in relation to mental health. For example, the biopsychosocial model. This model introduces a social component to the previously preferred biomedical model. The biopsychosocial model acknowledges that health, and more specifically mental health, is far more complicated and that health or ill health can depend on an endless number of social variables. The biopsychosocial model is both a philosophy of clinical care and a practical clinical guide. Philosophically, it is a way of understanding how suffering, disease and illness are affected by multiple levels of organisation, from the societal to the molecular. At a practical level, it is a way of understanding the patient's subjective experience as an essential contributor to accurate diagnosis, health outcomes and human care. For example, in the diagnosis and treatment of bipolar disorder. Bless is now going to present in detail about bipolar disorder. Bless.
Thanks, Gav. Now I am going to be looking at the definition of bipolar, types of bipolar, and suitable interventions with researched outcomes. Okay, according to the National Institute of Mental Health, bipolar disorder is, I quote, a mental health problem that causes unusual shifts in a person's mood, energy, activity levels, and concentration. Basically, this means that this condition influences how we feel and how we act. Bipolar, as a general term, is split up into three disorders, namely bipolar type 1, bipolar type 2, and cyclothymia disorder, of which all of them are mood-changing disorders. They also all have manic and depressive symptoms, with bipolar 1 and bipolar 2 being categorized as manic and depressive episodes, whilst cyclothymia is not as intense as the other two. The difference between bipolar type 1 and type 2 is that type 1 consists of manic episodes which are more severe, whereas type 2 consists of hypomanic episodes which are less severe. This is a similar case to their depressive episodes, where type 1 has depressive episodes that occur for at least 2 weeks, whereas type 2 they can last up to 4 days, which is significantly less. Service users with type 1 also experience at least 4 rapid cycles annually. Now talking about symptoms. Manic episodes just prove that too much of everything is bad. Service users can feel elated and hyperactive to an extent that they cannot find the need for sleep or rest. Another symptom is racing thoughts, whereby the person has so much to think about and so much to say at the same time because of flight of ideas on their mind. Some manic episodes make service users overconfident and feel invincible, like they can do anything, even the impossible. Some can also have excessive desire to pleasurable things, for example, sex, food, or drinks. Whereas depressive episodes are the opposite. Service users feel anxious and worried to an extent that they do not see the need for sleep. Some cannot remember some details about their life and are energetic and unable to concentrate. Other symptoms also include suicidal thoughts and feeling useless due to lack of self-esteem. Moving on to causes. According to the National Health Services, experts believe there are a number of factors that work together to make a person more likely to develop bipolar disorder. These include biological factors, social factors, and psychological factors. An example is hereditary, which is a biological factor, as in some cases, service users have family members who previously had it, but there is no gene responsible for bipolar disorder. Also, social and psychological factors are a cause, as social life altering events such as divorce and heartbreak affect the psychological aspects too. Nevertheless, every problem has a solution. Therefore, I will be moving on to talk about suitable interventions with evidence from research. The first intervention is going to be cognitive behavioral therapy, which is a psychological intervention whereby a service user can talk to someone, more likely talking therapy. It consists of about 20 individual sessions over 6 months, with an exception for additional booster sessions. It was observed in a research that it is effective for preventing relapse when used with mood stabilizers. The study consisted of 103 patients diagnosed by the DSM-4 to have bipolar 1 who experienced frequent relapse. They were put into two groups, namely the control group and the CBT group. Both groups got mood stabilizers and psychiatric follow-ups, but the CBT group was the only one that received an average of 14 cognitive therapy sessions in the first 6 months. The group also received 2 extra booster sessions in the second 6 months. Positive results came during and after the 12 months. The CBT group had fewer bipolar episodes, fewer days of bipolar episodes, and fewer admissions of bipolar 1 compared to the control group during the study. After the study, the CBT group members became more social and faced less fluctuation in manic episodes. To sum up on cognitive behavioral therapy, the pilot study reviewed that indeed CBT and mood stabilizers prevent relapses. Another effective intervention is dietary. There is evidence that change in dietary from polyunsaturated fatty acids to foods with high omega-3 and low omega-6 foods improve mood stability. 82 participants with bipolar 1 and bipolar 2 were randomly put into two groups, which were the control that was fed unsaturated fatty acids and the high omega-3 and low omega-6 group. The investigation was controlled for 48 weeks with 12 weeks of intensive diet interventions. The mood symptoms were measured twice a day by ecological momentary analysis paradigm. At the end of the investigation, it was discovered that variability in mood energy, and pain was reduced in the high omega-3 and low omega-6 group members compared to the control group. Therefore, the study proves that diet influences the mood symptoms of a service user. With this, I conclude my chapter on bipolar disorder.
Thanks, Bless. In conclusion, this presentation has explained what mental health is and how theoretical perspectives affect how it is analysed, the biopsychosocial model and how that theoretical perspective takes into account a social aspect of any service user, bipolar disorder and how the biopsychosocial model is used to diagnose and treat it by way of symptoms and interventions, and just how effective those interventions are. And with that is the conclusion of this presentation. Thank you very much for watching and listening. Goodbye.